a patient of mine told me that she has started doing cold plunges every morning because she saw it online for joint pain. The same week, another patient asked me if infrared sauna could be helpful. And a different patient swore that her massage was the best for her joints. And if you have rheumatoid arthritis, fibromyalgia, or chronic joint pain, you've probably wondered the same thing. Are any of these actually worth trying? So today, I'm going to walk through 4 of the most talked about alternative pain treatments: cold plunge, heat, massage, and red light therapy. Some of these genuinely help. Some help something, but not necessarily your joints. And one of them can actually be risky for a specific group of people. I'm Dr. Neha. Let's dive in. Let's start with the one everyone is asking about right now: social media trend. But stick around, because the one that surprised me the most was actually number 2. So cold plunge is everywhere right now. Athletes are doing it, influencers are doing it. People are claiming all kinds of things, that it helps inflammation, pain, mood, recovery, basically everything. And when you go into cold water, your body sends out a burst of stress hormones. Cortisol and norepinephrine, they spike almost immediately. And that's that genuine fight or flight response, that same thing that kicks in when you're startled or under some stress, like you're swimming in the waves and all of a sudden you see a shark. That's going to get the hormones going. So is that cold water plunge. That's why people often feel so alert or awake afterward. You're not imagining the jolt. It's a real hormone surge. And that same stress response is also why it can be risky for some people, which I'll come back to. So what does the evidence really show? Now, there is some small research in fibromyalgia using whole body cryotherapy. These are cold chambers, not exactly the same thing as an at-home ice bath, and in some studies, people did have short-term pain relief. But the important part was that the benefit did not seem durable. It helped for a while, but then that effect faded. For rheumatoid arthritis specifically, the evidence is a bit thinner. There's some early research looking at cold water immersion combined with exercise as a recovery tool. It's interesting, but it's tiny. Small studies, so small numbers of people, and when a trial only includes 15 or 20 patients, 1 or 2 people responding really well can throw off the whole result. It doesn't mean that the finding is wrong, it just means we hold on to it loosely until we see some bigger studies that confirm it. But here's the part that I really want people to hear. It's not that cold exposure does nothing. Some people really do feel better from it. They may feel more alert, more energized, or their mood is better, and that can be a real benefit because rheumatoid arthritis can cause all kinds of things. Even mentally, it can affect you. But that is different from saying that this is actively treating the underlying joint disease or inflammation that you see in RA. And then we have to talk about safety. If you have Raynaud's phenomenon, and that's where your fingertips, they can turn red, white, blue, purple, usually a combination of those, when you're exposed to cold or stress, you have to be really cautious with this. And a lot of people with autoimmune disease have Raynaud's, along with their initial autoimmune disease, or they could have it separately. And cold exposure can trigger this blood vessel spasm, very painful, in the fingers and toes. So this is not just some people don't like the cold. This is a please talk to your doctor before doing this kind of situation. So my verdict on the cold plunge: it may help mood, alertness, or that feeling of recovery for some people, but it is not proven as a durable rheumatoid arthritis joint pain treatment. And if you have Raynaud's, this is one I would pause on and discuss with your doctor first. Now, here's the one that a lot of people don't expect. Number 2 is heat. And heat may actually be more practical for a lot of arthritis patients. Heat is less flashy than a cold plunge, but clinically it often makes more sense. Heat increases the blood flow and relaxes those tight muscles around the joints. And that's a simple reason why it could help stiffness. And what holds up your joints? Your muscles. So if they're tense, and they could be tense for so many different reasons, it could be that you have started using your opposite hand in an awkward motion because this one is flaring. It could be anything. And then if you get a massage because your shoulder is now hurting and that helps, that's great. And there is one important distinction: acute versus chronic pain. So if you have a fresh injury, let's say you suddenly just tripped and fell and you have a lot of pain in your knee, or your rheumatologist just gave you a joint injection. At that point, we generally use icing because we've created a new bruise-like area in this place. And ice can help calm down that active swelling. But once something becomes chronic, you've had it now for months, this type of pain, then, especially if there's stiffness without any obvious swelling or heat, the answer is really a lot more individual. It could be that heat helps you, and it could be that cold helps you. It could be that you're somebody that needs to alternate heat and cold, and that seems to work the best. There's no universal right answer for chronic stiffness. The right answer is the one that's actually helping you. Now, for rheumatoid arthritis, morning stiffness is a classic symptom. Part of that has to do with the inflammatory signals that tend to build up overnight. So when someone says, I need a warm shower first thing in the morning to kind of get everything loose and going, it's not just for comfort, it's more of a practical strategy that's working with your body's rhythm because it has all these cytokines and molecules everywhere that have built up overnight. And there's also some research on repeated gentle heat therapy, including infrared sauna protocols, suggesting a possible benefit in fibromyalgia symptoms, which can often go along with RA, and these were seen in small studies. So infrared sauna specifically has less dedicated research, so I wouldn't claim that every sauna blanket or the infrared device online has proven pain benefits. But as a general principle, heat can be very useful for stiffness, muscle guarding, and getting the body moving. The caveat here, if a joint is actively hot, swollen, and inflamed, it's a flare, heat can sometimes make it worse. And that's different from the baseline morning stiffness. So my verdict on heat, probably one of the most practical options for morning stiffness, chronic tightness, and muscle guarding. But I would avoid putting heat directly on a hot, swollen, tender, inflamed looking joint. For that, you probably need medication adjustment or a phone call to your rheumatologist. So overall, there could be something to the infrared sauna. Waiting for the studies. Next up is the one that almost everyone has tried at least once. And there's a reason it doesn't work for everybody, which nobody really explains. But save your judgment for the last one, number 4, because that's the one people are spending the most money on, and there should be some proof for it, right? So number 3 is massage. And it's interesting because it's not just working on the muscle. A lot of the benefit seems to come from calming the nervous system down. When people are in chronic pain, their body can stay in this tense, guarded state. Massage can help shift the body out of that. There's pretty solid research in fibromyalgia showing that regular massage can reduce pain and improve sleep and mood. The keyword is regular here. A single massage may feel good for a day, but the studies show that the more meaningful benefit usually involves repeated sessions. For rheumatoid arthritis, massages can help with muscle tension around painful joints. It may help you feel better and move a little more easily. But again, we have to separate symptom relief from disease control. Massage does not treat the immune system inflammation that drives RA. If your joints are swollen and inflamed, massage is not a substitute for RA medication. And there's a nuance to massage also. Some people with fibromyalgia or chronic pain have something called allodynia, where normal touch or pressure feels really painful. Like if somebody gives you a hug and that really hurts, or if you go to the doctor's office and they put a blood pressure cuff on, inflate it, and you're like, that was so extremely painful, and it shouldn't have been. That's what allodynia is. And for people who have this, a massage, especially a deep tissue massage, can really backfire. So if you ever had a massage and felt worse afterward, that doesn't mean that massage can never help you. It may mean that the pressure was too deep, the technique was wrong for you and your body, or your nervous system was just too sensitized at that moment. Gentle massage, lymphatic style work, or lighter pressure might be a better fit. My verdict on massage: good evidence for fibromyalgia, symptom relief, especially with regular sessions. Potentially helpful for muscle tension around arthritis pain, but avoid aggressive deep tissue work if pressure worsens your pain. And don't use massage as a replacement for treating active RA inflammation. I don't know if you've noticed this, but the treatments that we're talking about that are getting the least social media hype, like heat, massage, have some of the best evidence. That should tell you something about how we decide what's worth trying. Last one, red light therapy. Super hot right now, all over social media. It's trending, so you should know about it. But the real story here isn't whether it works, It's what are you actually buying? Because red light therapy or biomodulation uses specific wavelengths of red or near infrared light. And the idea here is that it may help cells produce energy more efficiently, which may reduce pain or inflammation. There are small studies showing modest pain benefit in fibromyalgia and other pain conditions. And I'll tell you why this topic comes up in real life. One of my patients who has RA told me that his cousin sells red light laser devices to veterinary practices. But whenever she visits him and he's having a flare or having some pain in one of his joints, she'll take out the machine and she'll, use a red light laser on that joint. And he swears it helps. I believe him. He seems to feel better, and that's amazing. The question is, which device was it? What was the wavelength? What was the dose? How often did you do it? And does that translate into reliable arthritis treatment? Because there's a catch with the at-home devices. Nobody's selling you a massage on Instagram. Nobody's selling you a $15 heating pad with a discount code. But cold plunge tubs and red light panels, those are products with a lot of marketing budget behind them. That doesn't make them fake though, okay? It just means that the loudest voice in the room isn't always the most accurate. Most of the positive studies use specific photobiomodulation devices with specific wavelengths, dosing schedules, and treatment protocols. So not necessarily the thing that you're ordering online. That's very different from assuming every at-home red light panel being sold online will do the same thing. So when someone says red light therapy works, what I'd like to know is, where did you get it done? With what kind of device? And what are we comparing this to? So this doesn't mean that it's useless. It could very well help. It just means that the evidence that we have currently doesn't fully translate to all red light lasers work. So my verdict on red light therapy: it's plausible, it's interesting, and possibly helpful for some people. But the device and dosing matter a lot. I would not call it proven a treatment, and I would be cautious about spending a lot of money on at-home panels based only on marketing claims. Your body's response to pain therapies is individual. If cold plunge, heat, massage, or red light genuinely make you feel better and it's safe for you, it's not harming you in some way, then that's real and it's worth keeping. But none of these replace rheumatoid arthritis treatment. If your joints are swollen, warm, progressively stiff, or you're losing any function, that's not going to be solved by a sauna or a cold plunge. That's more likely active inflammation, and it needs to be treated like that. So the goal is not to chase every trend. The goal is to find out what helps your body move better and avoid what makes you feel worse, and know when your pain is telling you something deeper is going on. If someone in your life keeps saying nothing helps their pain, you can send them this video. I'm Dr. Neha with Plant Forward MD. I'll see you next time.